Depression. It is the result of a combination of biological, psychological, and social factors. Imagine depression as a perfect storm, where several cold fronts meet. The biological factor, the chemistry of the brain. Neurotransmitters. There is an imbalance in chemical messengers such as serotonin, regulates mood, dopamine, pleasure and motivation, and norepinephrine, energy. Brain structure. In chronic cases, areas such as the hippocampus, responsible for memory and emotions, may show a reduction in volume, while the amygdala, the center of fear, becomes hyperactive. The psychological and cognitive factor. Cognitive bias. The person begins to use dark lenses. They filter out what is good and focus only on the negative. Cognitive triad. A negative view of oneself, I'm worthless, of the world, nothing ever works out, and of the future, it will never get better. Trauma. Childhood events or recent losses can create thought patterns that lock the brain in a state of constant alert or grief. The social and environmental factor. Trauma and abuse. Traumatic experiences in childhood or adulthood, physical abuse, emotional abuse, or neglect. Stressful events. Grief, divorce, job loss, financial difficulties, or social isolation. Lifestyle. Alcohol and drug abuse, poor sleep quality, and extreme sedentary behavior can worsen or lead to depressive episodes. How to get out of depression? The main strategy is not to wait for the desire to act, but rather to act so that the desire begins to return. Psychotherapy. Cognitive behavioral therapy, CBT, is one of the most effective. It helps to identify and change the thought patterns that trap you in depression. Maintain a minimal routine. Try to wake up, shower, and get dressed, even if you're not leaving the house. This sends a signal to your brain that the day has begun. The 5-minute rule. Commit to doing something for just 5 minutes. If you want to stop after that, that's fine. Often, the hardest part is just starting. Sleep hygiene. Try to go to sleep and wake up at consistent times. Movement. Physical activity releases endorphins and dopamine. Choose one that you enjoy. Nutrition and hydration. The brain needs nutrients to produce the neurotransmitters of well-being. See you soon.